now. So I think, even though there may be a few people joining as we continue, I think I'm going to kick off now. So first of all, good afternoon, everyone. Good morning, possibly, for some people in different parts of the world. Thank you so much for joining us today. I'm Jim McAuliffe. I'm the chair of Lighthouse Relief, and I'm joined by two key members of our ground team today, Khaled Alnaiemi and Pauline Klose. Khaled is our senior program coordinator. He's overall responsible for our program in Greece, and Khaled previously worked in our Athens protection team, going back a couple of years as an intercultural mediator and project officer. And Pauline is our program coordinator, working not just on a program, but also fundraising, comms, and a whole raft of other things. And we're absolutely delighted to welcome you to today's Lunch and Learn session, as we've called it, to provide a special update on our programming in 2025. First of all, very brief housekeeping note. So the session is being recorded. There are quite a number of invitees who couldn't make it today at this time, but we'd like to make the recording available to them so they can watch it afterwards. And so we'll be circulating a link after the call. And also, we've got planned a very short Q&A session at the end. So please feel free to put some questions in the chat as we go along. So as supporters of our works, for many of you will know that Lighthouse Relief is marking its 10th anniversary this year. And since 2015, we've had to continually adapt our programming to meet the needs of those seeking refuge in Greece, from our start as emergency response on the north coast of Lesbos in 2015 to providing psychosocial support for young people and families in Athens and many other things. We've spent nearly a decade now filling gaps in the humanitarian response, always hopefully adapting a participatory and trauma-informed approach to our work. So today, our focus in 2025 is on providing access to sport and safe spaces for residents of the two largest refugee camps on mainland Greece, Ritsona and Malakasa, which are both north of Athens. And this is where our programs are designed to strengthen the psychosocial health of participants, build their resilience, foster community connections, both inside and outside the camps. And obviously, this being our 10th anniversary year is a very meaningful moment for us. We're looking to reflect on our evolution as an organization, and today the conversation hopefully will highlight how the values that led to our creation continue to guide the way we work today. The challenges we face and the participants in our programs, most importantly, face are stark. Many residents live in conditions of deep insecurity, waiting months or even years for asylum decisions, often in environments that are unsafe and isolating. And as you can imagine, the toll on the mental health of those individuals is profound. And the gaps in humanitarian protection are urgent. But within these gaps, and I think this is the hopeful message from today, within these gaps lies the possibility for making a real positive impact, and that's what we hope to shed light on in the next half an hour. So we're very grateful for all of you who are here with us today to listen, learn, and maybe reflect on what it means to keep the light on for people seeking refuge. So let's begin, and it's my pleasure to hand over to Khaled and Pauline, who will guide us through Lighthouse Relief's current work. Thank you.
Hi, everyone. Thank you, Jim, and thank you, everyone, for joining us. As you see on the paragraph, in 2024, asylum application in Greece exceeded 60,000, which is the highest in 5 years, with a sharp 30% rise in children applying, leaving over 11,000 minors in isolated camp condition. Our role is to stay connected to the community and work with people to build a program that responds to a specific psychosocial health need of this population, specifically those living in Ritsona and Malakasa camp. We do this by developing and delivering programming that evolves with the needs of people seeking refuge. Through conversation with the residents, other NGOs and local partners, government representatives and camp managers, we hear directly about what is needed, what is missing, and what the situation allows us to do. Earlier this year, we saw a need of opportunities to leave the camp, both physically and mentally, in order to help residents protect their mental health in contexts that are often unsafe and highly uncertain. People spoke not only about the lack of physical safety, but also about the absence of connection and trust. As someone who lived the experience and who is part of this community, I understand the weight of boredom, low self-worth, and hopelessness that can creep into daily life. In response, we launched our Sport and Safe Space program in June. Our approach remained trauma-informed and participatory in both development and delivery of this program. Sessions are structured with safety and predictability in mind and remain highly attuned to input from participants themselves. My colleague Pauline will provide a closer look at what this looks like on the ground. Thank you.
Yeah, thank you so much, Khaled. Hi, my name is Pauline. So I'm going to bring this down to a really practical level, which is access. So reaching residents and consistently is still our biggest operational challenge and our top priority. So what actually restricts access today is first of all a very top-down management model. So movement in and out of the camps is highly controlled and restricted, both for residents as well as organizations and people working with the community. And the second factor is isolation. So both Ritsona and Malakasa camps are really isolated geographically, far away from cities. There is very limited public transport available for residents. Even a short trip can mean very long wait times, very long walkways without available footwalks or street lights or safety. And it can mean very long waits and uncertainty and lack of safety. So services really must come to the people in a reliable and safe manner. So this is really, these are the two big factors that we have to work with, the challenges that we have to face. So how do we respond to these restrictions around access is by really focusing on collaboration and building trust. First of all, we try to work very horizontally with camp staff, with other NGOs on the ground, and first and foremost with the community and the residents in the camps. So we are by now known and trusted by Ritsona and Malakasa residents, and being recognized and trusted by people on the ground really does matter immensely. For example, one long-standing community participant of our football program, which I will go into in a second, who has been living in the camp for over 4 years and is a very, very respected and trusted community resident in the community, helped us reach more families, especially young women and their children, in order to bring their program to them. So he literally went door to door, spoke to the people he know, introduced us in our work, and this provided us with contacts that we can then that we then spoke with, built trust, and introduced our programming. And from this community, we now are able to take women and children every week to our programming in Malakasa. So this has been a really nice development that showed how important these connections on the ground are. And secondly, we work really closely with government representatives that are active in the camp, as for instance, with the Ministry of Education. We work with the people on the ground, the representatives from the ministry who vouch for us to the camp officials, to the high-level management, in order to assure that we are able to take the children and take the families every week and keep that trusted relationship with the management and the representatives on the ground. And this is really essential in order to keep our program running. And yes, so let's talk about the program a little bit. What are we running right now? We first of all do football sessions twice a week with the young men from Ritsona camp. This provides structured routines for them to support mental health, teamwork, and positive social ties. Not just among each other, but also in cooperation with the Greek football team that we work with. So we provide training as well as friendly games and tournaments and things of this sort. So this kind of connection with the Greek community is very valuable. Secondly, we do women and children session that I mentioned in the Sama Community Center, which is very close to the Malakasa camps. There we provide safe spaces for women only with their children. This is something that is very important, especially for women in the camps, as safe spaces for that are female only are very rare. And there we provide sports sessions and movement sessions, as well as just a space to relax, connect, for the children to play outside of the often quite male-dominated camp. And thirdly, we are running a summer camp also in the Sama Center near Malakasa, where we have been providing 3 times a week warm meals, structured activities, as well as just a space to be and to connect outside of the camp, especially in the school holidays where there was hardly any structured activities for the children and families. This has been a really wonderful success of the last months. Yes, and since we started in June, we have proven reliability to the camp management and residents alike. This has allowed us to expand our women's sessions, like I mentioned, to women and their young children from Ritsona, which has been a really nice success that we really want to establish long term. And our open communication before, during, and after the sessions have built trust, even as our activities have evolved over the past weeks to accommodate new arrivals and new demographics and needs that we need to accommodate. We coordinate transportation from the camps to external venues through a local bus company that we work with, which makes participation predictable and reliable and really safe for the families. And to stay connected, we also have a WhatsApp group, as well as a WhatsApp contact where we share program updates and scheduling, and it also gives an opportunity for residents to reach out, share feedback and requests. In this way, we're in really, really close contact at all times. At this point, I want to mention one example that happened a couple of weeks ago. We were contacted by a young woman who has a walking disability, and she reached out to us if we were able to pick her up and bring her to our sessions because her 2 young children have not left the camp for weeks and are really suffering and struggling with that situation. And we were actually able to, since then, pick her up multiple times a week, her and her children, and she has reported to us that this has already really changed her children's behaviors and their well-being and mental health. And these kind of individual stories really shows us the impact and the value of the work. Yeah, so even in a very constrained environment with the limited budget, collaboration, trust, and dependable operations are allowing us to reach people week after week. And with that, I hand over back to Khaled.
For many people seeking refuge, the length of time spent in camps now stretch into years. This lengthy displacement has lasting effects, chronic stress, and long-term mental health challenges that will follow people well beyond the camp if left unaddressed. This is why safe space we create remain essential. They provide outlets for expression, connection, and healing in contexts where daily life can otherwise feel marked by isolation and uncertainty. Beyond that, we might adapt and We might adapt and the streamline activities, but sustained funding will allow us to continue reaching as many people as possible. Even as the resources tighten, Lighthouse Relief will remain present in Ritsona camp and Malakasa, adapting as we have over the past 10 years and continuing to keep the light on for those who need it the most. I'll bring it back to Pauline. Thank you.
Yes. So in regards to impact for young men, those football sessions that we provide really have been providing a safe outlet for negative emotions and a way for them to build bonds with fellow participants and strengthen the community life. Too often this demographic of young single men is overlooked in their struggle, even though their mental health pressures they face are really significant. So these football sessions have been a way to tackle that. And our work with women and children is especially important as women are outnumbered in most camp settings, and without female-only spaces, they have very few opportunities to truly relax. And in our sessions, women can unwind while their children play freely together in both quite unstructured as well as structured and guided activities. And we have seen the difference these programs make, not only through our own observations, but also through the words that participants have shared with us themselves.
Our football sessions here in Halkida foster community and help build social connections amongst the teammates. On the pitch, there are no borders, no barriers, just a shared passion for the game.
التدريب مع لايت هاوس تمام وبيخليك تشعر بالإيجابية والحاجة الأفضل مع في الكام وتطلع تلعب بحاجة ريحية وتمام ما في كلام 100 لايت هاوس.
جواد ممكن قلنا ليش ساعدتنا نوصل للعوائل والأطفال بالكامب؟
صراحة أنا شفت كثير عوائل بالكامب ما عندهم أنشطة بيسويوها وبيضلوا على طول الأسبوع بالكامب، فيها كثير أشياء بيفتقدوها ولازم يطلعوا برا عشان ينبسطون شوي مع أطفالهم عشان ما يتضايقون على طول.
These football sessions aren't just about physical exercise. Sports improves the mood, relieves stress, and creates a distraction from the worries of everyday life.
Help us keep the light on.
Keep the lights on.
I think we've come to the end of the main part of our little presentation. So first of all, thank you all for attending, and in particular, sorry those individuals who arrived a little after the start. Just to reiterate, we will be providing a recording of today's session, so we'll send everyone, not just those here now, but those who highlighted the fact that they'd quite like to see the presentation but couldn't make it. We'll send everyone a link. So if anyone has, after that little presentation, got any questions, please feel free to type them in the chat. We did get a few questions from people that weren't able to attend this session now. And maybe what I can do is I can read those out and address those very quickly to Pauline and Khaled. So one person said, if you do have to slim down the program, which activities would you prioritize?
Maybe I can answer that. Khaled, feel free to jump in. So if we were forced to slim down the program a little bit, we do want to keep the focus on reaching youth and children in a quite budget-friendly way. So our women and children sessions have been a priority and will be a priority to keep going long-term. As well as the football sessions, but these could also be realized in a little bit of slimmed down manner. But for sure, reaching youth and children and continuing that reliable work would remain the priority, even if we were to slim down a little bit the program.
Great, thanks, Pauline. Dina's just put a question in the chat. Hello and well done. Is there anything that we can do as allies or advocates of your work specifically? Maybe I can quickly say something here in relation to the slide that's on the screen at the moment. So this is basically highlighting our current fundraising and advocacy campaign, which we've called Keep the Light On. So obviously it's got resonance with our name, Lighthouse Relief, and the work that we do, which is hopefully being a beacon for hope for many. And in order, it's very obvious, but in order for us to be able to continue our work, we need funding and we need awareness. And so I think one of the things that advocates and allies can do is to highlight our work, highlight the campaign. There's a bit more about it on our website, but yeah, it's really important that we're able to keep the light on, and to do that, we need funding. So I know it's not a particularly original response, but that's one of the areas which would be great that allies and advocates could work on. Thank you. I don't know whether Pauline or Khaled, if you've got any other comments on that.
No, I think that we've covered it all, and just maybe like any support that will help sharing, bringing awareness for the situation, plus what you mentioned earlier. Any kind of support is appreciated and needed at this difficult time.
Also, if you have a significant outreach on social media, on other platforms, we are really happy to collaborate, create joint initiatives, joint posts. So anything like that, just contact us. We'd be happy to talk about it in any shape or form that is possible. There are a couple of other questions in the chat. So Paul asked if we just do soccer. He talked to Jim about cricket as well. Jim, maybe you can answer that one.
Yeah. So we did a short cricket program last November with a guy who runs a small British NGO, and we spent a week in Ritsona with children, basically teaching them the very, very basics of cricket. It was a great experiment, and we'd love to do it again. We've started talking to a number of organisations initially in the UK, including the MCC Foundation, to find ways to seek funding for some sort of smaller cricket programme. And it's my personal objective that we would be able to run something. I think we're probably looking at next Easter now, but some small programme which is focused on cricket. And we also know that certainly in the obviously in the Afghan community, there's a great interest and love of cricket, and that's something which we also want to work to bring out. So it's not just football; it's also been basketball. It's also been a range of other sports. I think the programs that we operate now are focused mainly on football. We have a collaboration with a local Greek football team, which works really well. And within the summer centre, which is just outside Malakasa, we also have a little facility where children and young adults can play basketball or volleyball. So yeah, there's a mix of sports, but I think it's probably fair to say that we focus primarily on football. And we also, it's worth adding maybe just very quickly that although football in the past has obviously been a male-dominated sport, we work very hard to include women and girls in our football sessions. And certainly last year, we recorded a 30% participation rate amongst women and girls. It's more difficult at the moment for a number of reasons to include women and children and girls, but we're working on that. So yeah.
Maybe just a little addition to that, because I failed to mention it during my during that part. In the summer center, during the women and kids session, as well as the summer camp, we also have access to a gym space. We work together with an organization called Refuge, who manages the summer community center. They're wonderful, and the facility really offers space for so many different kind of sports. We've been doing, in cooperation with an organization called Empowerven, self-defense lessons for women, as well as fitness, yoga, Pilates, lots of different things. So we do offer different sports, but these are based in Malakasa, and the football sessions right now are in Khaled. But we are very much open to expanding that also to different courts, different sports. Yeah.
Thanks, Pauline. So Nanlim has asked, are there teams coming to conduct, say, a 1-week summer camp? We've actually, I'm not totally sure exactly what you mean there, Nanlim, but we've been running a summer camp all summer, July, August, and it's running until the end of next week, I think it is, for children primarily who don't have any access to education during in Greece. The summer holiday is very long, and for residents of refugee camps, it's a really tough time because they have no access to any structured activities. So that's really what our summer camp is about, trying to add some structure to the lives of people that are feeling very, very isolated. I don't know whether I've got another, maybe Pauline or Khaled can add something to that, and we can then move on to the question from Natalie.
Maybe just adding to that, we might not continue to call it a summer camp, but we will continue our collaboration with Project Harmonia, which is the organization that provides us with freshly cooked food every day of the summer camp. And this cooperation will continue in the activities that we do in the summer community center. So this kind of space where you will be provided with food as well as activities and services will continue. In what form, it's not completely clear yet, but we will continue that that collaboration and those sessions in the summer center with certainty.
Thanks, Pauline. Thank you, Nadlin, for that question. And Natalie, two questions. What are some other activities, needs the residents said they want? Are there surveys, etc., that garner such feedback from them?
Yeah, I could answer that. For that matter, we are working on a survey that we will send it out to the community that participate in our activities in both camps to figure out and listen to them more closely and for them to feel freely answering the question and expressing themselves on which activities that they like the most in our activities, as well as if they would like something other than what we're providing in terms of some activities that they would like to do it and we don't know about in the community. And so far we started in a pilot surveys and to better understand and to help us firm our questions to better understand them and be more closer to them, if that makes sense.
And maybe in addition to those kind of surveys that we gather, if we get, for instance, requests for areas of support that we don't provide, like medical support, legal support, we do have a very close network of other organizations that also work in the same area. And then we mediate among each other and connect the people to the right organization if it's something that is outside of the areas that we work in.
Thanks, Pauline.
Maybe, yeah, sorry.
Yeah, no, and I was just going to say, just to add, so Khaled, obviously, his mother tongue is Arabic. Pauline also is a fluent Arabic speaker. So our two key program leads both speak the language that the majority of participants in our program speak. So communication and getting feedback is therefore much easier than it might otherwise be, I think. And then the second question that Natalie asked, is there support in getting residents easily to your activities? Very good question. And the challenge that many participants face is one of isolation. And it is actually the Greek government's objective to put refugee camps in inaccessible areas away from centres of population, which makes it very, very difficult for residents to access the type of services that we provide. So yes, we absolutely provide transport. That's one of our key costs too. Basically our two main costs are staff costs and transportation, which is basically providing renting buses to take people from, in particular, Ritsona, which is very isolated, to Halkida to play football or to the Sama Community Centre. So that's absolutely critical. I don't know, Khaled or Pauline, if you want to add anything to that.
No, I think that you covered it all. Thank you.
Thanks. And so another question from Paul, very relevant one about burnout in the volunteer community. Absolutely. I think I don't know, maybe Pauline and Khaled, you want to speak a little bit about this, but it's something which is absolutely at the forefront of our mind, in particular because just from the point of view of the way that our program works, we need to provide most of our service, for want of a better word, later on in the day and in the evening. So from a staffing point of view, it requires sometimes quite long hours. So Pauline, Khaled, in terms of burnout, any points you can add?
I mean, maybe just worth saying that we are all trained in trauma-informed approaches and how to work in this area and how to protect the people we work with as well as ourselves. So this is very important that everyone understands these kind of approaches to the work and knows how to deal with difficult situations. And I feel like the team has been really great at that, and we've been working together really well, learning from each other, sharing experiences, as well as times where someone might be struggling and then dealing with those situations. And the community, the volunteers that we've been working with have been really wonderful, really experienced and informed about the field. And although naturally with working with volunteers, there's always fluctuation, I feel like there is a lot of amazing people that are willing to support this kind of work and to continue working with us. So there is measures in place to support us all. But of course, it's something to be conscious of.
Yeah. And we also, that's in terms of a burnout, we have kind of find a structured way for us to rotate on days off, mandatory every month, just to have a break, not be constantly around the situation. Of course, sometimes we will be short on staff and we will rotate and burn ourselves a little bit more. But of course, that is what's needed, and we are happy to do it. But obviously, it's something that a priority for us not to burn ourselves out, to be able to provide the services on in the best way that we can.
Thanks, Khaled. One more question from Alnaiemi again. Interesting question. What if I were to mobilize a team to plan a 1-week program? Yeah, let's talk about that, Alnaiemi. That would be very interesting. And that's the kind of thing in a different way that potentially we might do with a cricket program. So mobilize a bunch of people who are trained cricket coaches in the UK and bring them out to Greece and run a short program. So that's kind of something which I have in mind. Obviously, you might choose a different program, may not be cricket, but certainly, yeah, let's discuss. So I think we've probably got to the end of the questions. Thank you for those. Very, very interesting and pertinent. I'm also obviously aware that we're just over the half-hour mark that we set ourselves. I hope that you found the last sort of 35 minutes or so useful. We've certainly very much enjoyed talking about our work, and yeah, I guess one of the key things, it was one of the probably the most pertinent questions that came right at the beginning in terms of what allies and advocates of our work can do. Please spread the word about what we're doing. And I think we're very conscious that in this year, our 10th anniversary, in fact, we celebrate or mark the date on the 28th of this month, so 20 days away. It's even more important to highlight the work that we're doing. So yes, and thank you all for being supporters of ours over many, many years, some of you. It's incredibly gratefully received. And before we leave, any final words from Pauline, Khaled?
Maybe just if you would like to, if you have any questions after this or any comments, please feel free to reach out. We will share our contacts also in a follow-up email to everyone. And thank you so much for your support and interest in our work. We couldn't do it without the community.
Yeah, thank you very much. Without your support, we wouldn't be here.
Thank you, everyone. Thank you for giving up your time, and we'll hopefully meet again. on a similar webinar. Thank you.
Thank you.
Thank you so much.
Thank you.
Goodbye.
Bye.